Welcome to St Catharine's and to Catz Chats, a series of lectures between our alumni, staff, students and our fellows. My name is Deborah Lovelock. I am Development Director and Fellow at St Catharine's College, and today I'm delighted to introduce our second Catz Chats, which will be between my colleagues, Professor Nick Morrell and Professor Stefan Marciniak. I do hope you enjoy.
This episode is about medicine at Catz. So thank you for joining us. Just to introduce ourselves, my name is Professor Nick Morrell, and I've been a fellow at St Catharine's for the last 7 years. I'm the Director of Studies in Clinical Medicine, so I take main responsibility for students as they enter the clinical school. With my other hats, I'm the British Heart Foundation Professor of Cardiopulmonary Medicine at the University of Cambridge, and I've recently been appointed as Director of the new Cambridge Heart and Lung Research Institute, which will open on the biomedical campus here in Cambridge next to Papworth Hospital in 2022. Stefan.
I'm Professor Stefan Marciniak. I'm also a Fellow at St Catharine's. I've been there for a couple of years longer than Nick. Like Nick, I'm a respiratory consultant at Attenbrook Hospital and at Papworth Hospital. In St Catharine's, I'm the Director of Studies for 1A Medicine, which means I'm responsible for medical students in the first year. I'm Professor of Respiratory Science, so I do research in basic molecular biology, and I'm also Director of the University of Cambridge's MB PhD programme. So Nick, to kick off, we probably ought to talk about the strong historical links between St Catharine's and medicine.
Yes, and I think by that, Stefan, you mean our benefactor, John Attenbrook, our most famous alumnus. The legacy of John Attenbrook is, I think, important to the college and important to Cambridge. As people will know, he was a fellow, a lecturer, and eventually bursar at St Catharine's College for a significant period of his life. He died when he was 39 years old. And he's remembered in the college because he's the only person, I believe, that's actually buried within the chapel, or at least his crypt is within the chapel. And he left a very important collection of texts, historical texts, medical texts in the college, which are often on display. And we still recognise his name and celebrate his name because we have a John Attenbrook lecture every year with a distinguished medical scientist giving a lecture, and our students receive a John Attenbrook Prize if they do particularly well. So it is an important legacy, and people will also remember that in his will he left something like £4,500 in the day around 1720, I think it was, which led to the establishment of Attenbrook's Hospital on the site of which is now the Judge Business School, but of now, of course, is on the Cambridge Biomedical Campus. So I think that is an important legacy for the college, and we do use that legacy as much as we can to promote medicine at St Catharine's. But I'm sure most people will be more interested in things happening today rather than 300 years ago. So, Stefan, would you like to just tell us a bit how things have changed and how things are operating these days?
Absolutely. So I think it's fair to say that St Catharine's remains very strong in medicine. In the whole of the university, there are about 270 medical students per year, and 11 or 12 of those each year come to St Catharine's, which means it's a nice group of students. They get to know each other very well, but it's a small enough group that we, the fellows, get to know them very well. But since there are 6 years of medical school, we have over 60 medical students in the medical society, and they interact a great deal across the years, and the students in the upper years are very supportive to the students lower down in the years. We have, for those 12 places, we have about 80 to 85 applications per year. So I think it's fair to say we're one of the more popular colleges for applications. And we really do get the pick of some of the very best students applying to Cambridge. But because we get so many applying to St Catharine's and we can only take 12, we actually select a lot of our very good students and put them in the pool. And so they can, even if they apply to St Catharine's and don't get a place first off, they very often get into Cambridge. One of the reasons we have such good applications to St Catharine's is we have a very good reputation amongst the students. They know it's a friendly and supportive college. But also the fellowship do an awful lot of work in terms of recruiting students. So a few years ago, Nick suggested, and we set up a medical open day. So one day when St Catharine's is purely dedicated to medical applicants, and we have about 150 to 200 students coming to the college that day when they have a series of mock interviews and lectures and supervision, so they can see what it's really like to be a student with us. And I'm pleased to say that a lot of the students who come to that open day end up applying to St Catharine's, and many of them get in. So our students do very well in the exams, and I think Nick might talk a little bit about this later, about how well they've done in distinctions this year. But I think we also do very well at recruiting good fellows. One of the advantages of St Catharine's is that much of the face-to-face teaching done in supervisions is done by quite senior medics. I'm Professor of Respiratory Science, but I actually supervise all of our first-year students in physiology. Professor Mike Nicholson, who's Professor of Transplant Surgery, does all of the supervisions in first-year anatomy, and so forth. We have Professor Anthony Davenport, who's Professor of Cardiovascular Pharmacology, and he teaches pharmacology in the second year. And I won't go through the long list, but very recently we've managed to recruit Dr. Rahul Roy Chowdhury, who is a senior lecturer in immunology, and he'll be the newest medical fellow joining our fellowship. And in addition to these recruitment drives to get students to apply to St Catharine's, we're also very keen at getting students from disadvantaged backgrounds just to apply to Cambridge. And so just recently I've recorded a lecture for the Sutton Trust, which will be distributed and hopefully increase the number of people applying to Cambridge to do medicine.
It's always very gratifying how we do interview and see and admit students from very different backgrounds through your interaction through the Sutton Trust, for example, and through our admissions process and the open days, which is very gratifying when we see that.
Absolutely. So Nick, that's our students, but this has been a very, very unusual year for our fellows and our students. So maybe you could take us back to March and April when everything changed.
It did, didn't it? And it changed incredibly quickly for everybody, of course, but particularly for in medical training and in medicine, things changed hugely and very, very dramatically. The impact on our students, as Stefan mentioned, we have 11 students in most of our years. And our final year students in year 6 were preparing to take their final exams and were planning to enter the sort of medical workforce at the usual time, which would be August, September this year. And as the pandemic hit, all the changes were made to exams, and essentially a meeting was held, and it was deemed on their track record that they had passed their final exams. They didn't have to take any further final summative exams. And they were then allowed to register with the GMC earlier than planned. Normally, again, this would have been in August, but they were allowed to register back in April, which meant they could join the medical workforce and contribute to the efforts to fight COVID. And indeed, that's what a lot of our students have been doing. When I first think back to when I first started at Catz, I think the very first admissions interviews that we did, there was one particular girl who we admitted at that time, and then she emails me over the last couple of weeks saying how she's now on the intensive care unit at the Royal Papworth Hospital looking after incredibly sick patients with COVID. It's amazing how time flies. I should mention that Papworth is one of the national and regional receiving centres for patients with COVID, with very severe COVID. So severe, in fact, that simply putting them on a ventilator is no longer sufficient to maintain their oxygen levels. So they can go on a special machine which allows oxygen to diffuse directly into the bloodstream called ECMO. So she would have been in an extremely tough environment, but she seems to be thriving, as do most of our students. And as Stefan indicated, there were a very good cohort of students this year. 2 of them achieved distinctions in the final exams. It's been a time of great change for all of us. The impact on other clinical student teaching is such that you can imagine that it's not a safe environment, particularly for young students to be there at the height of the pandemic on the wards. So whereas they would usually have been engaged in clinical attachments, getting exposure to patients in hospitals, that's all been delayed. So those clinical attachments have been delayed, and of course all their lectures have been online. So yes, some big changes for everybody. And Stefan, I think that the same is true in the sort of preclinical years.
So I remember having my end of Lent term DOS meetings with all the students, and we were laughing about whether they'd be coming back in Easter because it was really still unclear at that time. And I said, continue to go away, spend your Easter holidays revising just as if you're going to take the exams, because we still didn't know what would happen. During the next few weeks, very, very soon afterwards, the lockdown happened. But when they came back in Easter, we continued supervisions, but entirely by Zoom. And that was a really interesting experience, because it then really sunk in that our students, most of them are from the UK, but we also have many students from overseas. And I'd be doing a supervision, and it would be broad daylight in the coming through the window of the kitchen of one student, and it'd be pitch black at night with for a student who was having his supervision in Hong Kong. These supervisions continued during the Easter term, and we learned that the exams were going to be cancelled. So all the TRIPOS exams, all the end of years exams were cancelled. But of course, that's not possible for medicine, because it's a legal requirement for us to check the ability of our undergraduates before they can go to the second year. So uniquely amongst Cambridge students, the medical students are going to having to take their exams in September. And they've just been emailed their exam timetable this morning. So they're already beginning to tweet about it. And we are going to, as a college, we're going to lay on extra supervisions in early September so they can get back up to speed. But knowing our students, I'm sure they're doing very, very well. When they come back, we will continue probably with entirely web-based lectures, but we'll try and do some face-to-face supervisions again.
Time of great change for everybody. And it's been a time of great change for us as well, Stefan, in our working lives and practices. Do you want to say a few words about how things have changed for us in medicine and the research that we're doing?
Absolutely. So, as I mentioned, both Nick and I are respiratory consultants as well as being academics. When the lockdown happened, the first thing we both did was temporarily close our labs. Most of the labs in Cambridge, most of the labs in the whole of the UK had to be closed because social distancing and the lockdown applied to scientists just as much as it did to everybody else. It also meant that people in our lab, including ourselves who are clinically qualified, could return to full-time medicine. So Nick and I are normally less than full-time clinicians because we also have academic responsibilities. But we then returned to the hospital as full-time respiratory consultants, so we could work to help support our NHS colleagues with ventilating the most sick patients with COVID-19. Also, in both of our labs, we have medical trainees doing, for example, PhDs or postdoctoral research, and they also decided every one of them volunteered to go back full-time to do medicine and suspended their research so that they could go back onto the normal on-call rota. So we closed our labs, we went back to full-time work. We were fortunate because Attenbrook Hospital and Royal Papworth Hospital prepared exceptionally well. And I think East Anglia was not as badly hit as other parts of the UK. So both hospitals planned for the worst case scenario where we would have more patients than beds. And there was a massive expansion in the amount of ITU capacity in the hospitals. Fortunately, East Anglia wasn't as badly hit as it could have been. So at no point did we run out of PPE. At no point did we run out of beds. And I think the outcome for our patients was very good. We also had other responsibilities, Nick and I, and we were on various committees that helped coordinate the clinical trials. So many clinical trials were initiated in record time in order to try and find effective treatments for this new disease, because it hadn't been heard of before the end of December. One of those trials is probably already famous. You might have heard of something called the Recovery Trial, and both Papworth and Attenbrook were major recruiting centres to this trial, which recruited thousands and thousands of patients in the record time and found the first and so far the only medication that's proven to reduce mortality in COVID-19. It's called dexamethasone. So I'm really proud that we could contribute to that. So part of that was because of the excellent local planning. And part of that local planning was the discontinuation of elective treatment. So I mentioned Mike Nicholson, who's one of the professors of transplant surgery. The elective transplants were paused. A lot of elective surgery was paused. And the reason for that wasn't simply to make sure that we had enough bed space, but it did help in that. It also meant that we had lots of junior doctors. And so junior doctors who would normally be working on, say, the urology ward would be redeployed to become respiratory doctors or general medical doctors. And it was although it was a frightening time in some ways, and it was a hectic time. It was a time of immense camaraderie, and so I would be doing a ward round with my junior team, and only part of the way through did I discover that one of them was quite a senior urology trainee, and she didn't mention. She just said, "I'm your SHO," which is a junior doctor, whereas in fact she was quite a senior registrar in urology. But they simply got on with it and helped look after the patients.
I was working with plastic surgeons and eye doctors looking after acutely sick medical patients, but it seemed to work very well. Yeah, because they were very much up for what they were doing.
And one thing that was lovely is that we were all dressed in scrubs. So rather than my usual, my trademark tie and shirt, we were all on the wards in scrubs. And whether you're a cleaner, whether you're a nurse, whether you're a junior doctor or a consultant, we're all scrubs. And it somehow added to the camaraderie and the feeling that we were all in it together. And the hospital did some very lovely things. For example, it made parking completely free, but it also made all the food free. So we were all encouraged to eat at the hospital's expense, which is a small thing, but it did show that Cambridge really valued its medics.
No, I agree. It was a very strange time, and many of these changes were led by the clinical teams, I thought, as well, which was interesting to see. And as you said, we were wonderfully over-prepared. I remember a delivery of ventilator units into my office within about the first few days of the pandemic, which meant that I couldn't really get in or out of my office very easily. And thankfully, they were never actually required. But yes, a lot of people were redeployed, and certainly people from my lab, they, rather than doing the work that they normally do, which is on sort of rare heart and lung disease, they were busy ferrying samples around the campus, taking blood samples from patients admitted with COVID so that research could be done on those samples. Of course, there is an awful lot of research going on in Cambridge. It's like different sorts of research, understanding how this disease evolves and how it damages tissues and how the body fights it or overreacts to it. So a lot of research going on about that, but clearly, the profile of the vaccine is rightly extremely high. And of course, Oxford have the Jenner Institute, which is dedicated to discovering new ways of vaccinating against infectious diseases. So it's only natural that should be preeminent.
Absolutely. And as one of the national committees I'm on, called the Respiratory Translational Research Collaborative, which normally would meet 4 times a year, was meeting at least once a week to help coordinate these studies across all universities. So you might have a lead university where the principal investigator is based, but in fact, all large hospitals participated and recruited patients. And I think both Papworth and Cambridge were major recruiters to all of these studies.
Yes, I think one of the other great things that struck me during the early stages of the pandemic was that it was good to see people putting aside sort of partisan differences about different universities and whatever, and actually pulling together to do the best possible studies that they could and contribute to the best possible studies that they could. I think that was that came across well, particularly in the recovery trial that you mentioned.
So what are the priorities for us going forward? How is it going to affect our students from this Michaelmas and beyond?
Yes, no, it certainly will. And the clinical school are in the process of putting in changes to make sure that the students do get the exposure to patients that they need, and the appropriate training is put in place. But it will be a different environment for everybody. That's undoubtedly the case. We're feeling our way with this, and there's an awful lot we don't quite know how it's going to be exactly. There's a lot of plans being put in place. But I think we can at least reassure everybody and reassure our students that they will get a very full medical training. The world will be a different place. And I suppose in some way they're being prepared and trained for that different world and coping with the impact of coronavirus. On a research level, some of the research that is going on in Cambridge is around, as you know, Stefan, because you've been involved in organising this, following up patients with COVID, because although we recognise that the acute impact of having the disease is potentially life-threatening, those individuals who recover from the disease, especially if they have severe disease, are often left with or could potentially be left with long-term consequences that can affect multiple organs, brain, kidneys, heart, lungs, and so on. And this is a part of an ongoing research effort now. And along with colleagues around the country, we're following up patients who have been affected by COVID. And the one aspect that's of great local interest, because I'm a member of the pulmonary vascular unit at the Royal Papworth Hospital, is that it appears that, as you may have heard, for the people who are listening, that COVID can affect the cause thrombosis and cause blood clots to form in blood vessels, and that seems to occur particularly in the lungs. And so following up individuals to see what impact that is having on them long term, will they be left with a degree of breathlessness, can we do anything about that, is going to be an important study going forwards. I mean, Stefan, do you think, the college has put in some measures to allow reoccupation. How will that be different for the students?
First of all, safety is the most important. We want the students to be safe, and we want the staff to be safe. And of course, we personally want the fellows to be safe as well, because I'm one of them. But and so there'll be it will be different. We will have students living in, this will not be entirely distance learning. So students will be living in college, but they'll be in bubbles. And those bubbles will vary, and there'll be some students who have health problems and they won't be able to be in a large bubble, which would be associated with more risk. And there'll be students with no particular risk factors who may prefer to be in a larger bubble. So that's one thing. And because we have a wonderful mix of accommodations, we have St Chad's over on Grange Road, and we have wonderful accommodation in St Catharine's, we can make sure people are comfortably in those bubbles. Although the university, Cambridge was one of the first universities to declare that all of its lectures for the next academic year would be online, and they did this quite bravely early on when it wasn't quite clear, just so that there would be clarity for our students. So although the lectures will all be online, we're hoping that many of the supervisions will possibly return to being face-to-face, as long as we can make them safe with appropriate social distancing. And one alumnus, for example, has donated thousands and thousands of face masks to the college, so we'll be able to provide sufficient PPE to our students. The details, the planning that's gone into this is phenomenal, in terms of right down to how close people can sit next to each other in hall and how many sittings we would need in hall. So everything's going to be different, but safety is going to be paramount.
Wonderful. Okay, Stefan. So wonderful talking to you, and we have a couple of questions that were sent in by one of our alumni who's a medic, and the first one, which I think you're going to address, Stefan, is that this is from Rohit Verma, who asks whether, given that the sort of patient-doctor interaction and the proximity of that interaction is so important in medicine. View of the requirements of PPE and minimising risk of transmission, and the need to wear face masks and so on. He asks, how are the next cohort of students being prepared for practice, given the reduction or potential changes in their learning activities with direct patient contact?
Yeah, it is a great question. And I think one of the fears was that we would be stopping enough clinical contact. And we had to do that in the very early stages, as you said. We had to wind up the year early, and because we really didn't know how big the wave would be. Now we're in control. Now we know an awful lot more, and now we have processes that have been honed in battle the first time round. We are going to have a lot of patient contact with the student. For the students are going to have a lot of patient contact. They're going to, the clinical students will be, so we've talked about the undergraduates, the clinical students will be returning a couple of weeks early. They will have swabs to make sure that they are not carrying the virus, and then they will self-isolate. And once we know that they're completely safe, they will then be allowed back into the hospital, but only if we can ensure that they have appropriate PPE and safety. Other things, we as doctors now, we're doing a lot of our clinics via telephone and video conferencing with our patients, and so that is something that's going to have to come into the curriculum. But as yet, this is a work in progress. We're still currently finalising the safe way of getting them back into the wards. The next thing is to teach them how to deal with those new ways of doing medicine. So I think the other question that they were asking is, how are we going to continue to recruit students now that they have this scary COVID to deal with?
Yeah, I think the concern raised in the question was, whether we would have the same number of students applying to do medicine at St Catharine's, and how could we encourage people still to apply? And I suppose my thoughts on that are that actually I'm not sure this pandemic will have a negative impact on that. I actually think that raising the profile of the NHS and medicine and nursing, and we know that, at least from reading the press, that the number of applicants to nursing places has increased quite dramatically over the past few months. I suspect we'll see a very similar picture with young people who were thinking of doing medicine, who are now sure they want to do medicine. I think this could have that kind of positive impact on applicants to do medicine. Of course, we will know when we see the numbers that apply later this year.
Okay, well, thank you for everybody who's tuned in and listened. So it's goodbye from me.
And it's goodbye from me.
Goodbye.